On a daily basis, I'm actually bombarded with questions from patients regarding robotic knee surgery. So let me answer a few questions that I'm asked on a daily basis. What is a robotic knee surgery? How is it different from a conventional surgery? So in a robotic surgery, rather than doing the surgery on its own, or the surgeon does not do the surgery starting from its own, what happens is that we will make a virtual model of the patient's knee inside a computer. ये virtual model बनाने के बाद I can actually play with the position of the implant, the soft tissue balancing, the ligament balancing. These all things I can actually decide on the computer itself without doing the actual surgery. So if a patient is posted for surgery tomorrow, one day before, I know what is the behavior of that knee going to be. Before I go into the surgery itself, I know how that knee is going to behave and how the implant has to be put in the best possible position for the patient's best optimal outcome. So robotic makes this surgery very, very predictable. So people also ask me, does the robot do the surgery itself? So the robot is just a computer. It does not have any autonomy to do any surgical procedure on its own. What happens is that I will feed the coordinates of the knee, the specification of the implant into the computer, and the computer will make the cuts according to the surgeon's decision. At no point in time, the robot has the authority to bypass my instructions. Whenever there is a conflict between what I am saying and what it thinks, the robot will stop itself. So people also ask me, is robotic surgery safe? So robotic surgery is safe in two aspects. It makes the safety double. First of all, we are able to see the results even before the surgery is done. Secondly, robot actually has the ability to foresee what is going to happen after the surgery is done. That vision the surgeon never had. And in case there is any issue, the robot will actually not act on its own. So this makes robotic surgery extremely safe and predictable procedure for all the patients.